Hi, my name is Tracy, and this is my patient for today, Addie, and we're going to be doing an integumentary assessment. We will be inspecting Addie's skin, we'll be inspecting her hair and scalp, and her fingernails. When performing a skin assessment, we start with inspection. I will inspect Addie's skin, looking at the coloring of her skin. Noticing that it's normal for her ethnicity. It's evenly colored. Sometimes you may notice a difference in coloring if they have sun exposure too. There might be areas of their skin that's lighter than others. Sometimes their abdomen might be a little bit lighter too because it doesn't always necessarily see the sun. Her skin is even in the tone that it is. She looks hydrated. No dryness that's appearing. I can't see any visible lesions anywhere. I'm also going to be looking to see if she has any freckles or moles. She has some generalized freckles over her nose and cheeks that are just clustered together. No noticeable moles on her body. Also, I'm going to be looking to see if she has any lesions, any bed sores. Those would be on her bony prominences. So we check on her heels. Also, go ahead and roll to your right for me, Addie. We would see them back here on her coccyx, nothing there. Also on her shoulder blades would be a place for pressure ulcers. But just looking at her skin, again, it looks like the skin color is even. Go ahead and roll back for me, Addie. And there's no breakdown evident anywhere. I will now palpate Addie's skin as part of her skin inspection. I'm feeling for any sort of lesions, but I can also feel the temperature of her skin, that she's nice and warm. Sometimes we'll find on their extremities are a little bit cooler due to circulation, and I can feel her fingers are a little bit cooler. And her toes are a little bit cooler too. But her skin is warm. I can't feel any lesions or any masses at all throughout her skin. I can also check her skin turgor, which I'm going to do is right up here. Addie is going to pinch that, and I can tell that her skin is nice and hydrated that way. I can check her capillary refills too on her extremities. We would like to see those less than 3. Can you see that hand too? Less than 3 centrally. I'll check that right here on her chest. Less than 3 there. And then also down here on her feet. I'll check those. On her toes. Less than 3. Less than 3. I'm also checking and palpating to see if I can feel any edema. No edema in her lower extremities bilateral. And there's no edema in her upper extremities bilateral either. The thickness, she has normal thickness of her skin. It's not thin or frail, but her skin does look good. The texture is smooth and even too. I'm going to be doing inspection and palpation of Addie's hair and scalp at the same time. As I inspect it, I'm looking to see that her hair is evenly distributed. I cannot see any lesions at all on her hair. Her hair doesn't look dry. Her scalp doesn't look dry either. Now I'm going to go ahead and feel for any masses. Her head should feel round and hard. And her hair, the texture of it is smooth and thick, but it is evenly distributed throughout her head. No signs of hair loss. Also looking at her face too, no hirsutism is evident on her as far as distribution goes over the rest of her body. She does have eyebrows, eyelashes, and so you can see that her hair is evenly distributed. The last part of our assessment is going to be inspection of Addie's nails. Starting with the inspection of them, I'm looking for cleanliness. I'm also looking at the shape. Her nails would be round, and the shape of the nail bed too. Addie does have some lines which could indicate like a vitamin deficiency. So hers are not as smooth as we would like to see with our patients. I'm gonna look at your other hand too, Addie. I'm gonna actually look at her toes and look at the shape of her toenails. Let me see your other foot, Addie. And look at that. I'm also observing for pinkness of the toenails and of the fingernails. You can see that at the tips she has white, but that her fingernails look good. And we already did her capillary refill to check her circulation too.